Hi, I'm Dr. Charlotte Derr, and I'm here with your hot tip of the day, an alternative view for finding the inferior vena cava. Do you ever struggle to get this perfect view of the inferior vena cava? Well, we're going to show you an alternative way to visualize the inferior vena cava in case you don't have the perfect view on your ultrasound screen. Perhaps the patient is too gassy, or their body habitus won't allow you to visualize that IVC. Try this technique instead. Start by obtaining a right upper quadrant view and visualize the liver and the kidney, and center the interface of the liver and the kidney on your ultrasound screen. You might have a little bit of rib shadowing in the way, but that's okay. We're going to work around that rib. So here I've got a nice view of the superior pole of the kidney. From this view, I want to increase my depth on my ultrasound machine. And then I'm going to move my hand slightly anteriorly using a little bit of fanning at the same time. So as I come anteriorly and I do a little bit of fanning, I'm looking for the aorta and the IVC to come into view on the ultrasound screen. You might need to change hand positions in order to make that possible. So as I'm sliding more anteriorly, I'm starting to see two vessels appear on my screen. First is the IVC, and the second down deep in the far field is the aorta. And the IVC is our area of interest. So now that we've identified the IVC, we can work with the patient to have them take a slight inhalation, take a slight deep breath in, and that'll allow us to better visualize the two vessels. So deep we have the aorta, and then exhale just a little bit. And then coming into view now is our IVC. So this will allow us to do a visual estimate of the size of the IVC, which often helps us to determine a patient's volume status. You might need to slightly oblique through the ribs to visualize the IVC a little bit better and do a little bit of fanning. You can see how that changes our visualization of the IVC and brings that more into view. And then remember, down deep, you'll have the aorta. I'm Charlotte Derr. That's your hot tip. Now you give it a try.